All right, let's jump right in. Here's a rapid-fire review of must-know facts for your next exam or rotation. First up, aortic dangers. So the body's largest artery can tear. What's the #1 cause behind this?
You got it, hypertension. It's the culprit in a whopping 70% of aortic dissections. Blood pressure control is everything.
Remember, atherosclerosis is what drives penetrating ulcers, and watch out for anything over 5 centimeters. That's high risk.
Okay, let's talk about a classic syndrome you've absolutely got to know, Leriche triad.
So you're looking for claudication, weak femoral pulses, and impotence? It points straight to a major blockage.
Now, these associations are huge. Get this, 80% of coarctation patients also have a bicuspid aortic valve. And here's a dangerous link you can't miss. If you find a popliteal aneurysm, you have to look for a AAA.
All right, let's talk diagnostic clues. You see this tardus parvus waveform on Doppler? What's it telling you?
It means you've got a weak, delayed pulse. Basically, think of a kink in a hose. There's a blockage upstream.
And we can actually put a number on that stenosis. If the velocity is over 230, that's severe ICA narrowing. So what if you're hunting for a GI bleed? Well, a nuclear scan is 10 times more sensitive than angiography. Okay, let's switch gears to interventional radiology. Here's a conversion you just have to know. 3 French is 1 millimeter. And your catheter choice really matters. Use an end hole for delicate hand injections, but side holes for power injectors.
Thinking about a TIPS procedure? Well, heart failure is a flat-out contraindication, and a MELD score over 24 is bad news.
Okay, endoleaks. Type 2 is the most common one you'll see, but types 1 and 3, those are emergencies.
Now here are the do not drain rules. Seriously, draining any of these can be an absolute disaster.
Let's jump into nuclear medicine. You've got to know your agents, like MDP for bone or MIBG for neuroendocrine tumors.
And with PET scans, timing is absolutely critical. You got to wait a few weeks after chemo, even longer after radiation.
All right, let's wrap this up with some final pearls. These are the ones you really need to lock in for safety. First, radiation limits. A radiation worker's annual limit is a full 50 times higher than for the general public.
For your thyroid patients, remember, amiodarone blocks iodine uptake. And if the patient's pregnant, it's PTU.
So, knowing the rules is one thing, but the real test? Applying them under pressure when it really, really counts.